when we pass out of our colleges, they teach us a lot of polycrests. They teach us everything, almost all the materia medica is taught to us. When we pass out, we feel, arey wow, we now know how to differentiate when a patient walks in, ki haan, this is this drug, this is this drug, this is this drug. But when really a patient comes in front of you, it becomes extremely difficult, because he will tell you a whole gamut of symptoms. Necessarily there will be some from here, some from this drug, some from this drug, and sometimes it becomes extremely difficult to find out how to differentiate from one drug to the other. Today I am going to tell you about NATRUM Mur, because NATRUM Mur is almost 70% of the people in the world are NATRUM Mur. The reason for that, we have to go into back into civilization. When man was created, and in Adam and Eve and whatever you may call it, when he took the forbidden apple, and that guilt, that feeling of guilt which set into the man, that is the reason. And as civilization started developing, so many restrictions were brought on by society. You can't do this, you can't do this, you cannot behave like this, you can't behave like that, this is not the done thing, you have to not express yourself even if you are hurt. Those are the symptoms which a man keeps within himself, and once you start filling it up, it becomes very difficult to come out of it. And we have to keep our face, keep our keep a straight face, even though you are upset, though you are not happy about something. These are the things which bring on a problem with patients, and patients can come with absolutely any type of symptoms to you, and it can still be treated by NATRUM Mur if the main and the root cause is these. The reason why many a times we do miss NATRUM Mur is because many of the homeopathic doctors themselves are NATRUM Murs, because we are also a part of the society, we are also a part of this whole thing which we call civilization. We have also grown up, we have also had the same sort of experiences like you or me or whoever. So if we are NATRUMs, we think it's a normal behavior what the other person is doing. So we do not differentiate as this is okay, this is fine, this is it's normal. But he doesn't realize that he is missing out on almost 70% of the cases because of that. When a patient walks in to your clinic, you have to observe him from the time he walks into your clinic. It gives you so many important points. If a person walks into the clinic who is very delicate, who is very thin and tall, first thing is calcaria is out. So you know that even if the symptoms look like calcaria, it's not going to be that. Of course, you have to be open-minded about it. You cannot be dogmatic, just because the person doesn't look like a calcaria, he can't be a calcaria. It is possible, but the chances are much rare. In the same way, you find that as the person comes and sits in front of you, sometimes the patient will, if you have two chairs, one is closer to you, one is a little away from you. If the person sits next to you, he is very eager. He is very eager to express himself. He doesn't have that problem with you about expressing himself. But if he goes and sits on the chair which is away from you, there is a problem. He doesn't want to share. He doesn't want to express his emotions. He doesn't want to tell what is wrong with him. And when you start differentiating right from there, drugs start getting eliminated. Then when the person starts talking, the way he talks, sometimes the person will talk very vocally, he'll describe every symptom very distinctly, and he'll go into each, almost like a hypochondriac. Drugs get differentiated. Then when he starts telling you, some of them are so skeptical, is homeopathy going to help me? I don't even know what kind of system is this. The first thing will be that there itself you will differentiate the drug. There is a feeling of the unconventional. He is not used to the unconventional. He dislikes using unconventional things. That also is where, and that is a very common thing with NATRUM. They do not like to go into things. They are a little skeptical about going into unconventional things. They'll say, I don't know whether I'm going to be able to, if you people are going to be able to help me or not. They're very suspicious about these things. Whenever you think of suspicion, what is the first drug that comes to your mind? Yes, but it is not. First and foremost, that is what. Now when you think of claustrophobia, what comes to your mind? No, NATRUM is most important. It is never written in any way. As you see my chart, you will realize that because of the suppression of his emotions, because of the suppression of his and the guilt feeling, that imagine if a parent does not love the child and the child realizes it. A child is like a barometer. He can make out immediately if the parent has got conditional love or unconditional love. What would one expect from a parent? Complete unconditional love. Kuch bhi tum karo, you are going to be loved by your parents. Imagine a child who has doubt about that. It is such a tremendous hurt that the child keeps festering inside himself. That is where the beginning of NATRUM starts. That is where you can, all the feelings of hurt which are camouflaged. Okay, so I am hurt, I don't want to do this. And then he will show you different facades of himself, because each person will naturally deviate in different directions. He is not going to be the same type, because after all, individuals are individuals. Everyone will express themselves for the same stimulus in a different way. Now see, in this, if you look at it closely, if you go through each one of them, when a child is from a parent who is very gives materially, will give everything that the child wants, which is very common nowadays, because they don't have time for the for the child. Jo chahiye you are given, because whatever the child asks for is given. But do they give them quality time? The quality time and that affection that is supposed, the bond which has to be formed, is not happening. And because of that, the child will become very closed, he'll become very serious, he'll become very moody, he'll become a very meek child. Also, he can become, because of the hurt